Let's imagine this. You're out on a weekend hike. The air is crisp, your mind's clear, and suddenly, crack. Your misstep on a rocky trail. You feel it instantly, a sharp pain in your leg. Later, the X-ray confirms what you already suspected. It's a fracture. What happens now? How does your body actually heal a broken bone? In this video, I'll take you inside the incredible healing journey of your body. We'll walk through the 5 stages of bone healing, step by step, with practical advice on what you can do in each stage, how to move, what to eat, and how to support recovery. Stage 1. Hematoma formation, day 1 to 5.
Right after the fracture, blood vessels rupture and create a hematoma, or blood clot, at the break site. It may look chaotic, but this clot is essential. It's like the body calling for emergency responders. White blood cells, platelets, and healing factors all rush in.
Movement, immobilize the area completely. This is your body's setup phase, no weight bearing. Use splints or casts as directed. Gently move unaffected joints like fingers or toes to prevent stiffness.
Diet, prioritize hydration to support circulation. Eat antioxidant-rich foods. Berries, bell peppers, citrus. Vitamin C supports collagen. Protein is critical. Chicken, tofu, legumes. Avoid alcohol and smoking. They restrict blood flow and delay healing.
Our fictional hiker? He's in a hospital bed now, leg elevated, cast in place. The body's healing orchestra has just begun tuning their instruments. Stage 2, inflammation, day 5 to 10.
Now, the body goes into cleanup mode. Inflammation kicks in, not a bad thing here. It's the body's way of removing damaged tissue and signaling regeneration.
Movement, continue strict immobilization. Elevate the limb to control swelling. Non-injured joints, keep them gently mobile to reduce stiffness.
Diet, increase vitamin C intake. Citrus fruits, kiwi, bell peppers. Focus on lean protein sources, eggs, beans, low-fat dairy. Eat enough calories. Undernutrition slows healing.
Back on the couch, our hiker feels soreness and sees some swelling, but that's the body working hard behind the scenes. Healing is underway. Stage 3, soft callus formation, weeks 2 to 3.
Now the fracture begins to bridge. Fibroblasts and cartilage-producing cells lay down a soft, rubbery scaffold called a callus. It's not strong yet, but it's a vital connection.
Movement cast often remains, but if the bone is stable, passive motion may begin, always under medical guidance. Physical therapy might begin for nearby muscle maintenance, not for the fracture itself.
Diet. Focus on calcium like milk, kale, and tofu, and vitamin D from sunlight and fortified foods. Keep protein intake high. Add zinc from pumpkin seeds and lentils, and omega-3s from walnuts and flaxseed for tissue repair.
Our hiker's feeling better, no more intense pain. He's tempted to move, but healing bones aren't ready for weight just yet. Stage 4, hard callus formation, weeks 4 to 8.
The soft tissue callus hardens. Calcium deposits turn it into a more rigid protective structure called a woven bone. It's still not fully mature, but it's strong enough for gentle pressure.
Movement. Your doctor may now approve light weight bearing or assisted walking. Start physical therapy to restore mobility. Still avoid impact activities, no running or jumping yet.
Diet. Stay high in calcium, vitamin D, and protein. Add phosphorus from nuts and whole grains to support bone formation.
Our hiker can now slowly place weight on his leg with a crutch and a plan. He's not sprinting just yet, but progress is visible. Stage 5, remodeling, month 2 and beyond.
This is the final, longest stage. The body replaces rough woven bone with smooth, mature lamellar bone, stronger and better aligned.
Movement, gradually resume full weight bearing. Include resistance training and bone strengthening activities like walking and light weights, all under medical supervision, of course.
Diet. Continue a nutrient-rich, balanced diet, calcium, vitamin D, protein, zinc, and magnesium. Stay active. Avoid smoking and excessive alcohol. They hinder remodeling.
Months later, our hiker is back on the trail. Same mountain, stronger bones, and a deeper respect for how incredible the human body truly is. Final call to action. The human body is amazing, but it needs your support to heal well. Follow your healthcare provider's advice, eat smart, and stay patient with the process. If you found this helpful, hit the like button, Subscribe for more medically accurate, easy-to-follow health videos, and share this with someone recovering from an injury.
Until next time, stay strong, stay informed.